To be penalized or not to be penalized? That's the question on many Americans' minds recently. This year will mark the first year that every taxpayer will have to check a box on their IRS tax forms saying that they have health insurance or that they don't. To some, opting out saves much more money throughout the year, but it's definitely a gamble.
Obamacare has led to a rise in uninsured Americans. It's led to a rise in insurance costs, and the brunt of the costs of Obamacare are being covered by middle-class families that don't qualify for any exemptions.
Obamacare has caused quite the debate. While many young people have time and time again shied away from expensive health coverage due to financial reasons and having entry-level jobs that don't offer affordable health care, this year, some may be in for a rude awakening come tax time. Healthcare.gov states that in 2015 you'll pay the higher of these two amounts if you're uninsured. Yes, there are exemptions, quite a few of them, but much of the population won't fall within the guidelines.
Is it perfect? No, but it's a lot better than what we had, and nothing goes from disaster to perfection in one step. So this is just, I believe, a stepping stone.
A stepping stone is the right word, because Obamacare relies on much more than the overall population signing up for health care. In fact, it relies more on young people signing up.
Obamacare does definitely depend on sign-ups by young Americans under the age of 35. And this is actually not happening, because when a savvy young American under the age of 35 has a choice of the $695 penalty for not carrying insurance or the $5,000 bronze plan, which is the cheapest one under Obamacare, they are definitely going to save over $4,000 a year by not having health insurance. And it's led to a dramatic decrease in young Americans that actually have health insurance.
And if you do decide to sign up under the Affordable Care Act, you might be surprised to find that you don't even qualify.
Missouri has an issue because they chose not to expand Medicaid. What that means is we have what's referred to as a Medicaid gap. You have individuals that make too much money for Medicaid but not quite enough to qualify for the subsidies through the Affordable Care Act, making them not affordable.
Enter Kathy McKnight. Kathy has opted out, taking the penalty in exchange for insurance because she falls in that gap. After monthly bills and groceries for her boyfriend and 3-year-old son, she doesn't have enough to make it feasible.
We pay about $500 in rent, and then by the time you have groceries, and both of our cars are paid off, but the insurance, which is not too expensive, but you know, it adds up. Gas, lights. By the time everything's paid, you don't have anything to play around with.
The average lower middle class person makes roughly $26,000 a year. Now after taxes, that's about $1,600 per month. That doesn't leave much left at all.
Checkups like these might not cost much out of pocket, but what if it's something more severe? Is opting out your best bet?
For me, it was worth the risk, and I found out the hard way because I had to go to the ER and no insurance. But I think I'm probably paying less for that bill than I would have been paying insurance a whole year. So.
And that may be true for some, but for many, a trip to the ER can be extremely costly, anywhere from $200 to $3,000, depending on the severity of the condition and what tests and treatments are performed. In some cases, especially where critical care is required and or a procedure or surgery is performed, the cost could reach $20,000 or more. If Medicaid is expanded and the majority of the population sign up, then
the cost of healthcare is going to start gradually going down, because you're not going to have the lawsuits, and you're going to have they can sue these individuals all they want.
And they do. Mosaic Healthcare sues so many individuals that it became a national story. Senator Chuck Grassley from Iowa is astounded at Mosaic's collection practices and claims that they may be breaking the law by doing so, since they're a nonprofit health facility.
As a nonprofit hospital, we really have two requirements. We have to benefit the community, and we have to provide charity care. And the senator recommends about 5% in charity care. We actually fund about 7%, 7 to 8% in charity care.
Mosaic's Board of Trustees said they would have an announcement by the end of the month as to whether or not they will make these changes with their policy, but they're under no legal obligation to do so. So with this in mind, is opting out your best bet?
They're going to start down the path of we're going to get money from these individuals and things are going to get paid from the uninsured at basically whatever cost, then yeah, obviously it would probably be a good idea from that standpoint to go ahead and look into getting insurance. That way, even if you have a higher deductible or higher out-of-pocket max, it's going to cap out at $6,000 rather than $200,000.
But is Obamacare constitutional? Many feel that it's not, and a large part of the population are fighting against it.
You know, penalizing the middle class with the $695 a year penalties per person or 2.5% of your income is just not what we really had envisioned from our founding fathers on capitalist principles. This is a draconian policy from the Obama administration that I think that we must fight at every single level.
There's no doubt that this topic is far from over. Many states are protesting Obamacare on every level, while others believe in it wholeheartedly.
Choosing not to have health care is a gamble, and to some it's a gamble worth taking. But ultimately the choice is yours. Jeremy Lyons, Fox 26, KNPN.